In Washington, President Biden is in isolation again after another positive COVID test over the weekend. The president had appeared to be over his COVID infection after testing negative last week. His doctor calls it a, quote, rebound case, which can happen in patients like Mr. Biden who have been treated with the antiviral drug Paxlovid. Chief Washington correspondent Major Garrett is at the White House. Of course, we've been monitoring updates, Major. Any idea on how the president is feeling this morning?
Well, good morning, Drake. Good morning, everyone. The president says he's feeling fine. His physician says he's experiencing no symptoms. But as everyone knows at this stage of COVID, every positive test is disruptive, and the president's schedule has been disruptive. And all this, of course, has also cast a presidential spotlight on rebound cases. In a Twitter video on Saturday, President Biden announced he tested positive again.
I'm feeling fine. Everything's good.
The president tested positive on Sunday as well. His physician called it rebound positivity. The rebound came after negative tests Thursday and Friday. In a small number of cases, patients can rebound after taking the antiviral Paxlovid, as the president did for the prescribed 5 days. Paxlovid reduces the risk of COVID hospitalization. It does not eliminate the virus.
In the clinical trials of Paxlovid, less than 10% of people experience a rebound of symptoms or test positivity after completing their course of Paxlovid.
While testing positive after taking Paxlovid is rare, Biden's chief medical advisor, Dr. Anthony Fauci, did so last month.
Paxlovid may not cure you. You may still have a rebound of symptoms or test positivity, but it worked if you did not end up in the hospital.
President Biden is not receiving additional treatment for COVID and has gone back to working in isolation. As cases linked to the BA.5 Omicron variant of COVID continue to rise nationwide, Dr. Celine Gounder recommended Paxlovid to reduce risk.
Far too few people in this country are accessing Paxlovid than are eligible. Upon completing that 5-day course, you should test yourself and see if you remain infectious to others.
The president has none of his original COVID symptoms, runny nose, cough, low-level fever. He had 6 close contacts before that positive test on Saturday. All have tested negative, as has the First Lady, who's tested negative throughout the president's COVID odyssey. And as is prescribed, the president will await 2 negative tests before resuming full duties. Jerika?
Major, before we let you go, I want to ask you about the burn pit legislation that was stalled in Congress. Republicans supported it not long ago, and now they're holding it up over what they say are budgetary concerns. Where do we stand with that?
So the Senate Majority Leader Chuck Schumer said he's going to bring that legislation back to the Senate floor today for a key procedural vote with the hopes of passing it by the end of the week. Now, this legislation would not only provide relief to veterans exposed to toxic burn pit fumes, but also those exposed to radiation, Agent Orange. Huge piece of legislation with, as you said, Jerika, large bipartisan support until last week. Republican objections over budgetary language. It's not clear if they can be overcome. There were protests on the steps of the Capitol this weekend. President Biden sent over boxes of pizza. He said he would have gone over personally, but you know, COVID. Jerika, back to you.
Yeah, we'll see if the pizza helps. Major Garrett, thank you.